landmarks of the shoulder and arm. Inspect and palpate the following on your partner. The suprasternal notch, the clavicle, the acromion, the greater tuberosity of the humerus, the lesser tuberosity of the humerus, the shaft of the humerus, the superior and inferior angles of the scapula, the Sternoclavicular Joint, the Coracoid Process, the Acromioclavicular Joint, the Bicipital groove on the humerus, the Deltoid Tuberosity of the humerus, the spine of the scapula, and the lateral and medial borders of the scapula. Muscles of the shoulder and arm. Inspect and palpate the following on your partner. Sternocleidomastoid. The origin of the sternocleidomastoid is a mastoid process on the temporal bone. It has two insertions, one down to the clavicle, the other to the sternum. The biceps brachii muscle has a long and short head. The short head originates at the tip of the coracoid process of the scapula. The long head originates at the supraglenoid tubercle of the scapula. The distal attachment for the biceps brachii muscle is the tuberosity of the radius and fascia of the forearm via bicipital aponeuroses. The Pectoralis Major muscle originates on the clavicular head, the anterior surface of the medial half of the clavicle. The sternocostal head from the anterior surface of the sternum, the superior 6 costal cartilages, and the aponeuroses of the external oblique muscle. The distal attachment of the pectoralis major muscle is the lateral lip of the intertubercular groove of the humerus. The deltoid muscle has its proximal attachment at the lateral third of the clavicle, acromion, and spine of the scapula. Its distal attachment is the deltoid tuberosity of the humerus. The Coracobrachialis muscle has its proximal attachment at the tip of the coracoid process of the scapula, and its distal attachment at the middle third of the medial surface of the humerus.